Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Alejandra, Content Marketing Specialist at 3W Medical for Women and the host of today's podcast. Hello, everyone. Welcome back to another Wellness Wednesday with 3W episode. I am here today. My name is Alejandra. I'm here today with Lauren Wooding, our office manager. Hello, Lauren.
Hi, guys. How you doing, Alejandra?
Really good. Really good.
Good to talk to you today.
Thank you. Thanks for being here with me.
Of course.
Today, well, it's the month of June, and there's a lot of awareness days, right, in each month. But today, we're going to be talking about National Safety Month, which you would think is not such an exciting topic, but we wanted to share a little bit about how we're practicing safety here at 3W and what your role is as far as safety in the clinic. So for those who don't know, Lauren is our office manager, but she is also our safety officer. So she takes charge of a lot of the little nitty-gritty things of keeping our clinic safe. So just tell us a little bit about that.
Yeah. So something that the clinic achieved in 2019 is AAA HC accreditation. And with that, we have to keep up a lot of safety procedures, safety logs, and just checks around the clinic to make sure that we are at the highest standard of care. And with that, we're keeping our patients and our staff members and our volunteers in mind. With that, I am monthly, daily looking through the clinic, making sure there's obviously no hazards, there's nothing that needs to be addressed, but on the bigger end, conducting drills quarterly and, yearly, like a fire drill, chemical spill drill, earthquake drill, things that could happen to our clinic or to our employees. And then monthly looking to make sure our fire alarms are working, our security alarms are working, our AED that we just got is operating if we ever needed it, our fire extinguishers are up to date. And with that, those monthly checks, we keep logs to then show AAAHC that, yes, we say we're doing this, but look at our proof to doing that. And that is just keeping us on track to maintain that accreditation, but also keep our members and our patients, our staff members and our volunteers and our patients very safe. And if an emergency were to happen or a break-in or anything, we would know exactly what to do. It wouldn't be a question of, okay, what do we do next? It would, we've practiced this, or I have this policy in place and this is how we're going to operate.
Cool.
Yeah. And it really keeps us accountable to what needs to be done and the safety. So it's nice. It's not like we have to guess and think, okay, how are we going to be safe? We have an exact plan of this is how we maintain our safety in the clinic. So
that's great. Well, I know for sure when you popped a random fire drill, we were all surprised. We're like, what's that sound? We're like, everybody to the front.
Yes, exactly.
But yes, it's great. And in regards to COVID, what types of things have we put in place?
Yeah, I think, so we had WISHA, which is kind of the LNI or OSHA of Washington State, walk through our clinic in September and just make sure everything was safe. And this was the first time they were walking through the clinic with COVID. We had a 2019 survey or walkthrough and a check. And she was letting us know, you had a lot of things in place because of AAAHC safety-wise that we would have asked to put into place when COVID came about. We had them already. So we have like a hand hygiene log where Annabelle, our medical assistant or a volunteer, will see Dr. Rutherford or our provider or themselves do hand hygiene. So that's, using your hand sanitizer before going into a patient or washing their hands before they're touching a patient. They log that. So it kind of tracks like, okay, yes, we have our providers who are washing their hands or keeping their hands clean. Another thing, we have a cleaning log. So every time a room is cleaned, after we see a patient, it's logged. Bathrooms are cleaned every time we see a patient. And that was what a lot of companies and places had to put into place with COVID to show that they were keeping clean, we already had those in place, which was awesome because that was from Triple HC letting us, making sure we had that, but we already were like passing with flying colors.
That's awesome.
One thing we added was a temperature log every day and a symptoms log where employees and staff take their temperature and make sure they don't have a fever. If they have a fever, they're sent home, or they have symptoms, they don't come in. And then additionally, patients are checked at the door with their temperature. Everyone obviously wears masks. And we just follow whatever CDC says and the Washington State Department of Health says. And then with Triple HC, they'll give us different, like we've created policies about COVID-19 and how to operate if someone does test positive and what is an exposure and all those things. So it's really just keeping up to date. And me and Taylor, our executive assistant, she actually achieved our accreditation. She was a big part of that in 2019 before I came on as office manager. And she is really a wealth of knowledge and all of that. So that's her baby, her first baby to say.
Yeah, I know I wasn't even here at the beginning, and just hearing about all the steps that she took and then you coming on and both of you being such a great team and, ensuring the safety of the clinic and our patients and staff. So it's great. It's great. And it's something I think even in regards to injuries, like there's a lot of things that maybe employees in their own jobs don't think of safety. Like, we should make sure that we have these things in place. Right. So it's nice to know, like coming into 3W, like there's not only things in place for COVID, but also just in general, right? Yeah. Safety procedures and precautions.
Yeah. So, I mean, there's a thing called an OSHA 300 form, which happens if a workplace injury happens. And since I've been here, we haven't had to fill one out, but we do an incident report anytime there's a minor thing that happens related to safety or patient safety or volunteer issue. And we go over that in a quality improvement committee that meets quarterly. And so we don't want incidents to happen, but we like when they do and they're not major, they're not going to hurt anyone or damage anyone, but it is ways for us to get better. So let's say someone left an instrument in the sink overnight that was used for taking out an IUD. That can't happen. We need to be putting those away and sanitizing them and all the things. So we can create an incident report to show to our clinic and to our staff and also to the person who will check our Triple HC accreditation. We saw this issue and we're working towards improvement because we're not always going to do everything perfect.
Right.
And if we're doing these little incident reports and focusing on fixing issues when safety matters come up, hopefully that's preventing a huge safety concern from happening and something that could have been prevented.
Yeah.
In the healthcare world, we call some of these called near misses. So sometimes if you think of it as a Swiss cheese, there's these circles. And if something got through one of the holes, there might be another Swiss cheese on the other end and the holes didn't match up. So something caught it. Let's say, for example, Annabelle was drawing blood and she wasn't wearing goggles. And she was retracting the needle, didn't release the tourniquet, blood splattered. It didn't get in her eyes, but it could have. So that was a near miss.
Gotcha.
A near miss is usually what happens if all the things were bad, it would have been bad and it would have been a true incident. But because by chance the blood didn't splatter, it just went onto her shirt and not her eyes, she didn't get blood in her eyes. But we still would have wrote an incident report because we would have shown this was a near miss and this could have caused an infection, issue with Annabelle, and a full incident report and an OSHA 300 form. So we document these near misses where, if she would have worn goggles, if Annabelle would have been wearing goggles, which she's supposed to, and I'm not saying she doesn't do this, but we're doing a hypothetical situation.
Right.
This has never happened to Annabelle. But if she were wearing goggles, it wouldn't be considered a near miss because she would have had all the safety issues or safety protocol in place.
Right.
So the near miss was her not wearing goggles. And it would have been a true incident if it got in her eyes. So things like that, we make an incident report about and we talk about as a team and we show how we can improve to both ourselves and to the people who are making sure we are giving the highest standard of care and having safety in mind. So,
that's great. Yeah. That's great. Well, I hope this is encouraging to all our listeners that, maybe feel uncomfortable coming into a clinic for the first time or maybe because of COVID, you know, have concerns about safety or even just security in their visits, just be assured that 3W is very, very on top of it and does take seriously our standard of care, not only for safety, but just in general.
Totally.
Women's wellness. So
yeah, I mean, I think it's huge to be at a place where you know everyone is doing their job and doing it well.
Yes.
And this is just, you know, affirming to patients that we don't just kind of on a whim, you know, we are seeing patients. It was a very thought out and detailed, and there's policies behind this and procedures that we follow. And I think especially when you go to a small clinic, you think, oh, they're just like they don't know what they're doing. We know what we're doing. Even Dr. Rutherford, and I don't mean to pat myself on the back, but Dr. Rutherford will say, and she's worked in big hospitals. She was in charge of a whole department in maternal fetal medicine. Yes. She created the department. And she'll talk about what me and Taylor are doing and say, oh my gosh, if they wanted to work at a big hospital, they could. They know how to do all these things that like big hospital organizations do. Right. Like when we credential our providers or we do these safety drills, she was like, oh, they could leave us and go work at these big places. And this just affirms that we are meeting the standard of care to HHC and to big hospital organizations that have known how to do this for many years and have these things in place and have, you know, huge departments for infection control and huge departments for safety. We are a small team and we can delegate those jobs to people because our team's small and we don't have, you know, hundreds of employees to keep safe. We have 10, but it's affirming to hear that we are hitting the standards of big hospital organizations in our area. And that Dr. Rutherford, who has been in there, affirms that because we're like, oh, because I've worked in big hospitals, but not at the level she was, where she was in charge of a department. Yeah. And another thing, she has connections to her old hospital colleagues and just departments. And she'll just, if she has questions about things we're doing, she'll say, I'm going to ask them and get back to us. And we can always ask our HHC, you know, colleagues and things like that. But it's nice to have that affirmation that, yep, 3W is meeting the standards. And we have that from many different sources. So
that's great. Yeah. That's great, Lauren. Well, thank you so much for this. I know it's kind of a shorter podcast, but I hope it's encouraging to our listeners. And I know for sure every time I come in, I'm like, yep, we're good. Yeah, totally. We got everything taken care of. Totally. So any other suggestions or things you'd like to share with our listeners or even potential patients?
Yeah. I mean, I think a big thing, I hear a lot of people, I'm the office manager, like I said, and I talk to patients on the phone and I hear some people have put off their well woman exams because of safety concerns about COVID or just, you know, being nervous. And I think when you come to 3W, you're going to be taken care of. You're not going to be put in harm's way. And we do everything in our power to make sure it's a positive experience and a safe one. So if you are, you know, debating, oh, should I come in? Should I, you know, see more people? Just know that it is a good thing to come take care of your health. And if you put off things too long, they can actually have, you know, a negative effect on your well-being where something that might, you're scared of a hypothetical situation that probably won't happen because we have the safety things in place and we have been open the entire time during COVID and haven't had an issue and haven't had an incident. And we do that because we have your safety in mind. So
that's great.
Come on in if you're on the fence and we'll take care of you and have all the things in place to make sure you are safe from start to finish.
Awesome. Well, thanks, Lauren.
Yeah, it was great to have me again. Thanks for having me for National Safety Month. I didn't even know June was, and now I feel like I get this recognition for being safety officer.
Yes, that's very important. Well, thanks, Lauren, and thanks to all our listeners, and stay tuned for our next episode. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you liked this episode, please share it with others and consider subscribing on your favorite podcast platform so you'll never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.